Today our group will be presenting on the Jamaican culture. I'm Dan.
Amy.
Anna.
Shannon.
Hopefully by the time we're done, the audience will be able to describe the Jamaican culture in general. We'll be able to identify traditional and modern Jamaican health beliefs and influential factors such as culture, family, diet, and religion. We'll also be able to describe culture-bound syndromes that impact the Jamaican population, as well as analyze Jamaican health statistics and the prevalence of certain major diseases. And this is an outline of what we're going to go through. So first, the basics of Jamaican culture. I think everyone knows that Jamaica is an island, but it's actually the third largest of the Greater Antilles in the Caribbean. And it's a volcanic island that has mountains in the center. It's a much more temperate zone, and then it has a tropical coastal region. The history of Jamaica is rich. It was settled by the indigenous Taino and Arawak people from South America who actually came across the Caribbean and the Gulf of Mexico in dugout canoes. They were eventually conquered by the Spanish in the 1600s. The Spanish were conquered by the British, and the Jamaican people actually gained their independence in 1962 from the British. The island has about 3 million residents with a median age of 24. Now, compared to the U.S., which has a median age of 37, Jamaica has a very young and vibrant population with a lot of potential. Their motto is out of many, one people. And Jamaica really is a melting pot. We think of the U.S. as a melting pot, but most of the population of Jamaica has come from around the world. There's Chinese and Indian and obviously the African slaves, descendants. The official language of Jamaica is English, though a lot of them do speak patois, which is or sometimes called Jamaican Creole. It's a mix of the African dialects, Spanish, Portuguese, and English. The flag of Jamaica, which you can see in the background here, has 3 different colors on it. It has green, black, and yellow. The green is for the wealth and the agriculture of the country. The black is for the historical hardships that I mentioned previously. And then the yellow is for the abundant mineral resources and the abundant sunshine from the tropical region. Religion, the major religion is Christianity, with the Church of God of Prophecy being the largest denomination. The Church of Jamaica, if you think Church of England, this is sort of a remnant of the British reign there, and the wealthy and elite are the main members of the Church of Jamaica. Rastafarianism is another minor religion in Jamaica, though it gets a lot of publicity because of reggae stars like Bob Marley. Speaking of reggae, music and arts, reggae is the dominant music form. There's also a lot of traditional sculpture, pottery, basket weaving, and wood carving because of the African and South American heritage. In Jamaica society, race still plays a large role. Most of the wealth on the island is still concentrated in a small number of white families, with the Indian and Chinese immigrants being close behind. Dark-skinned African descendants are still considered to be inferior, and race again plays a large role in Jamaican culture. Health beliefs of Jamaicans, they tend to define disease as the absence of illness. They don't look at it as health as something that health is the absence of illness. They don't look at health as something that needs to be maintained. And most Jamaicans find the cost of healthcare to be burdensome. There's a quote that was in an article by Dr. Bourne. It said, "Wherever effort involved to seek healthcare creates more discomfort than the medical condition itself, healthcare utilization will be low." Traditional influences on health decisions include an inverse relationship between class status and location. Those that live in rural population or rural areas are less likely to seek health care than those in urban population centers. And those of lower class are less likely to seek health care as those with more resources available to them. Among the African Jamaicans, those who come from the African tribal heritage, illness is still seen as being caused often by evil spirits, or what they call obia, or as a violation of cultural taboos. Most illnesses are treated holistically with either bush doctors or medicine men, though there is some creeping influence of Western medicine. Some of the culture-bound syndromes, Jamaican vomiting sickness or a key toxicity, is similar to Rye's syndrome, causes nausea, vomiting, gastrointestinal distress, hypoglycemia, and CNS depression, and is caused by eating the unripe fruit of the ackee plant. Fright is a psychiatric illness that's common throughout many Latin American cultures. It's called different things depending on where you are, but it's prolonged distress, fear, panic, or grieving brought on by traumatic events. Next, Anna's going to discuss some dietary considerations of Jamaican culture.
The staple foods in Jamaica include rice, yams, breads, fruit, and peas. Also, they eat a lot of fish, beef, pork, and goat, and poultry. As you can tell, this diet is high in carbohydrates and also fat. But they eat small portions and they have a very active lifestyle with walking as one of their main transportation, and so it balances out. Also, they eat fresh versus processed food, and they season their foods with herbs, scallions, and onions. The family structure is mostly nuclear, and extended families either live under the same roof or they live nearby. Grandparents are very involved in their grandkids' lives and often help raise the kids as the family or the parents are at work. In the household, the man is considered the breadwinner and thus is very reluctant to go to seek medical help because he could lose time at work or he could lose the financial income. Because of this, the woman is the leader when it comes to searching for medical advice and making appointments. Some tips for the healthcare providers. First off, Jamaicans often feel the responsibility for providing routine care for the family members while in the hospital, such as bathing and feeding. So as best as a nurse can, they should accommodate this cultural need. Next, nurses should be sensitive to the placement of elders or ill family members in nursing homes because the Jamaicans view this as possibly neglect. And lastly, nurses should be sensitive in relaying information about mental illnesses because Jamaicans value intelligence. Religion has served as a hope for better life and an outcry against slavery. Thus, is very important to the Jamaican culture. Church is a source of information and emotional and financial support during crisis. For instance, church members will relieve family members during the night shift. Also, it's vital for nurses to connect the patient with these support circles. Jamaicans use folk remedies to counteract the evil forces that they believe in. They believe mental illness is caused by investing demons called duppies. So, they use spiritual rituals to treat this mental illness. Also, shamans use excoriations and blowing tobacco smoke over the body in order to counteract. Lastly, patients with mental illness often don't seek treatment because it's considered a cultural stigma. Next, Amy's going to talk about the statistics in Jamaica.
Okay, so the birth rate in Jamaica is 18.65 births per 1,000, and then here we can also see the death rate, which is 6.63 per 1,000. The top 4 causes of death in Jamaica in ranking order are coronary heart disease, stroke, HIV/AIDS, and violence. And violence is a huge issue in Jamaica. The life expectancy for males is an average of 71 years, and for females a little higher at 75 years. The physician's density is 0.4 per 1,000. So as you can see, they don't have the available healthcare providers like we do here in the U.S. Also, the obesity rate was 28% versus the 34% in the U.S., so it was still high up there. The Jamaicans' attitude towards medicine, still a lot of Jamaican folk medicine is used, that's common, but often they're combining that with our modern Western medicine. 94% of Jamaicans saw no harm in using both forms of medicine, and their preferred course of treatment is first by self-medicating using over-the-counter herbals, then they seek professional help by a medical doctor, and then from there they can go on to seek a spiritual healer or bush doctor, and often they'll wind up combining both folk and biomedical. Their reasons for using both of these treatments, the top reason was that they saw no harm in combining these two. The second reason is that they believed to have a faster recovery rate when combining both. And then the last reason was that the pharmaceutical drugs would not suffice solely on their own. Some problems with mixing both of these are drug-herbal interactions, inaccurate dosing of the herbal remedies, and just the combined effects of using both. This is an example of an herbal remedy used in Jamaica called the breadfruit leaf. It's used to treat a variety of illnesses, anything from hypertension to heart disease, and also has some anti-inflammatory properties. The latex of the fruit can also be spread out over the skin to treat anything from broken bones, sprains, and sciatica of the spine. So pain relief measures in Jamaica. Their view of pain is that God is the mediator between good and evil in daily life. So oftentimes they think that pain could be the result of things that they've done, past sins, and it might be deserved. They seek over-the-counter pain relief and self-remedies before seeking professional medical help. And here's also another herbal example called the Jamaican dogwood. And this is a pain relief herb. The health decision makers, most Jamaican families are matrilineal. The woman is in charge of the household and responsible for all the healthcare decisions and for looking after the children. Oftentimes women don't want to establish permanent relationships with men, and that could be because of the fear that they'll leave them. Also, the fact that they could want the children and take custody of them. The male authority and position as head of the household could be there still in some families, but this is just dependent on his economic contribution more to the family, and this position is not assumed. And now Shannon is going to discuss the nursing process.
Okay, first, as a community nurse, we would assess the Jamaican culture. They have a lack of available healthcare resources, such as the brain drain, which is the lack of available health professionals because of the migration to wealthier countries. Most of the nurses, because of the unavailable healthcare resources, are feeling burnt out, and they have a lack of the financial ability to take care of patients. Our nursing diagnosis consists of the risk for ineffective health maintenance related to the lack of healthcare resources, as evidenced by the low physician density, the migration of the healthcare professionals, the increased rate of the chronic diseases, and the lack of health-seeking behaviors. As a nurse, we would plan to increase the knowledge of the primary prevention strategies used in this culture and provide stable environments for physicians and nurses to prevent the migration. Some interventions we would use is we would go out into the rural community and use health fairs and immunization clinics to better increase the knowledge in this culture. We would include education such as basic hygiene. As nurses, we would use our ability as community nurses to increase the nursing recruitment and the retention of these nurses via bonuses. We would also advocate for the increased educational opportunities for the future healthcare providers. Some evaluations we would use, we would have the patients display evidence of increased knowledge of these primary prevention measures and also survey doctors and nurses about migration possibilities. Our class standards, we felt, for the Jamaican culture, providing an effective, equitable, understanding, and respectful quality of care and services. Because the nurses and doctors, there is a migration from Jamaica to wealthier countries. About 80% of the Jamaican nurses and doctors move to wealthier countries. That includes 8% of registered nurses and 20% of specialty nurses. We would recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce because this is a very needed place because Jamaicans don't have that basic knowledge of healthcare in their culture, so we would just need to spread out more information to them to prevent those chronic diseases. Also, we would conduct regular assessments of the community and health assets to plan and implement services to better help the Jamaicans. And partner with the community to design, implement, and evaluate policies, practices, and services for culturally and linguistic appropriateness. Some of the Christian worldview, we need to act as Christian nurses in the community to minister to these people. They basically are Christian because they practice the Christian faith, but they also use spiritual witch doctors, which can hinder their care. So, as nurses, we need to remember these biblical verses as we go and serve the community.